Good evening and welcome to Health Check. My name is Grace Mutiso, and today we want to focus on a very important topic, the spine. Is your spine healthy? How do you even know it's healthy? And what do you need to do in case it's not healthy? And I want to welcome you to be part of this conversation. Our SMS line is 22232. That is 22232. We're also live on Facebook and YouTube. Our handle is at Hope TV Kenya. That is on Facebook and YouTube. Those are the platforms you can use to interact with us as we proceed on with our conversation. Tonight, our guest is Dr. Immaculate. I had to take time to, say her second name slowly. Dr. Immaculate Wambalaba. Have I gotten it right, Doctor?
You did.
Yes.
Good job.
My producer, Eunice, is very happy after the rehearsal she did on me. But finally, she's gotten it. And she's a chiropractor.
Yes.
Yes. And she's here to help us, discuss about your spine health. Again, our SMS line for any question or feedback you have is 22232. That is 22232. Or engage with us at Hope TV Kenya. Dr. welcome.
Asante sana.
There could be someone watching and wondering who is a chiropractor and what does that entail? Let's start there.
Okay, a chiropractor is somebody, we are doctors who are specialized in taking care of spinal health. We make sure that the spine is in good shape so that it can do what it's supposed to do. So basically call us just the spine doctors, making sure that the spine is in good alignment so that your body can have optimum function. Yes. So chiropractic basically looks at the alignment of the spine, because we understand everything virtually about you is run on this spine. Maybe I don't know if I should just start by explaining a few things so that you can understand. All of us are born with a spine, and our spines almost look like this. This is almost about the adult spine.
And where is the spine found, just in case, in our body?
Now, this is the spine, but the spinal cord actually now passes from inside. It runs inside amidst this vertebrae. So you see the function of the bony spine is actually to protect the delicate now spinal cord. You always hear spinal cord.
Yes.
The spinal cord is the extension of the brain. So you see, your brain will sit up here, and it's in the bony covering protection of the skull. Okay?
Yes.
Then it extends down as a spinal cord, and it is protected by these vertebrae. Okay? And then in between these vertebrae, there are spaces in between through which nerves. Now, nerves actually branch out from the spinal cord, and the nerves branch out to go to different parts of the body to allow for different functions to happen.
Yes.
So because every function of you is run by a nerve.
Yes.
So when it exits from this point,
the yellow,
and these are now your nerves. Yes. Now they are going into different organs. They are going into muscle. They are going to, so that function can happen. So it's a communication that happens from the brain, because everything is processed in your brain. Then the information comes down and goes, and then your body also sends back information back to the brain. So it is actually a cycle that keeps going on, and it is actually beyond our control. You don't sit and tell your eyes blink.
No.
Blink. Or you don't sit and tell yourself, breathe. Breathe. Now I'm breathing. We'll be so tired. Actually, we would die by age 2.
Yeah.
That's terrible. So all these things just happen without us knowing, and that's why I would want to encourage us to know that we are truly fearfully and wonderfully made. This is something that just happens on its own. So what a chiropractor does, we are looking at the integrity mostly of this protective cover for that nervous system.
Yes.
Because if one of them moves, now this spine is movable, it's not solid.
Yes.
And it is movable into many different segments, as you can see, to allow you movement. That's why we are not like trees or poles, electric poles.
Yes.
We are able to rotate, we are able to bend because of this bones being separated.
Yes.
Now, what can happen sometimes is that they can lose position, given that they're mobile. they can lose proper positioning one against each other. Now, when that happens, what it can do, it can interfere with these spaces through which the nerves come out.
Okay.
And that will interfere with the communication from the brain coming down into the body. I can give you an analogy.
Yes.
Now, but this is the era of cell phones. Let's go back to school. Those days, old school,
Yes.
when it was landline. You're calling Nakuru, you're here in Nairobi. You're calling Nakuru, but a tree fell somewhere in Naivasha. That communication won't happen. So you have to take that tree off so that that line of communication is restored, so you can freely talk to someone. So if you have a misalignment somewhere, it interferes with that communication from the brain through the vertebral column to the body and back.
Okay.
So we look at the integrity of the alignment of this, and should we find anything is out of alignment, we put it back into alignment. Using externally, we do not surgically.
Yes.
Yes.
So I hear you use terms like alignment, check the integrity of the external bones. I can see the white parts.
Yes.
That's what you'll be checking.
Yes.
On the back, and in between the white, there is the yellow part, which you've said it's the nerves.
Yes. And then, you see, in between the bones, these are the bones, the vertebrae, that's what
Yes.
they are called.
Yes.
You have 7 of them in the neck, then you have 12 coming to form the thoracic spine. So we call that your cervical spine. That's mostly your neck.
Yes.
Then we have the thoracic spine, which has 12 of them. And then we have your lumbar, which are 5. And that's the one most of the time when we talk of my back is paining, mostly it's somewhere down here.
Yes.
And then we have now down here the sacrum and then your pelvis. So that's pretty much what it looks like. But in between this vertebrae, you see these are your discs.
The ones that appear like sort of transparent.
Yes, because discs are actually cartilaginous. They are not bony. So you can find also, these also help with flexibility and cushioning so that they don't even rub against one another. But on top of this, it's not only just naked like this. There's fat in there, there is muscle, you've got ligaments and all those things that just make this a stable structure. So when it loses its alignment, like you've mentioned alignment.
Yes.
Let's assume this bone moves out, and these bones actually move in several directions. It can move forward, it can move backward, and it can also rotate to the sides. So you can have a misalignment in any of those components. And so what we do, we are trained now. We are trained to be able to feel what is happening because the proper alignment. Chiropractors work with their hands mostly,
yes.
But of course nowadays you find there's a lot of equipment that help us to do what we do. But ideally when you feel with your hands, you're able to feel that alignment and tell this one has moved this way. So what do I need to do? Actually put it back in this place,
yes.
In proper positioning with the one above and below it. So that now these spaces are restored, the disc is more comfortable, and the nerve can exit freely.
Okay.
So that it sends that information. Yes.
Thank you, Dr. Immaculate. So somebody could be asking, with all the explanation you've made in terms of setting the foundation for us, so how will I know that my spine is healthy or it's not healthy?
Number one, the first thing normally that happens when you start having pains, pain is a very good indicator that something is not right. Whenever you have pain, stop and check. You see, most of us ignore those little pains we feel. We say, ani kidogo tu, but it's not kidogo tu. That's the body telling you something is wrong. So number one, you might get discomfort. You might find you go to bend and alas, I cannot bend.
Yeah.
You find your flexibility is, you cannot even, for example, even turn your head. You want to reverse, you have to turn your whole body, yet you're supposed to just be able to turn your neck.
And that's not the issue. They say, ulilala vibaya, you need to get a slap so that... You've heard of those as
yeah.
well.
Oh, yes.
It's not that.
It could be actually, because you see, if someone gives you a slap,
yes.
But it just gets that vertebrae in the right place, don't you think it can put it back? But it has to be in the right direction. So just not any slap would work.
Okay.
Okay?
Yes.
So you find you have limited range of motion. You're not able to perform your activities of daily living freely and comfortably. Number two, you might find now even sometimes your ability to even for your body parts to function the way they should. Like you can find sometimes you get numbness.
Yes.
You can find you're having sensations. That's the word I'm looking for. You get sensations that are not normal. You find you're getting numb. All those are signals that something is not right. Numbness. Sometimes you can't. This hand is always hot. A finger can be hotter, or you feel one leg is feeling heavier than that. Means there's an issue somewhere that needs to be investigated. What is it? Yeah. And definitely some of those things can arise from the spine. Yes.
Okay. And you know, it's sounding that, Dr. Immaculate, as the spine is a very important part of our body that we need to take care of.
Critical.
So what other parts of the body are affected if the spine is not okay?
To be very honest, everything about you, because that spine governs everything about you. Everything about you. Even how your stomachs is run by these nerves. Remember I told you these nerves come from the communication from the brain, comes down through the core to the nerves to now the different places it's going. When that communication is not there, you have what we call dysfunction. It's not functioning right.
Yeah.
Because even for my hand to be able to flex, even me to be able to move a muscle, it takes a nerve. It's a nerve issue. It's a nerve coordination that has to happen. So many times when the spine is not in line, we can say chances of anything and everything happening is possible because everything about you is governed by the spine. We can take, for example, if normally someone gets into a very bad accident and they always say you got a spinal injury.
Yes.
Now, and paralysis happens. It's because something on the spine has been tampered with. So you find now with that person, you can't walk, you can't feel, just because of the spine.
Yeah.
So injury or damage or some simple misalignment hinders your function, your 100% optimum function, if the spine is not in line, or if something happens to your spine. So your spine governs everything about you. Because everything starts from the brain. You see, even when they say someone is in the coma, in a coma, see, that's now the brain that's been put to sleep.
Yes.
They have to put machines to keep your heart going. You're hooked up on machines to keep those functions happening. So this is a very important structure for us because it's the computer, the CPU, it runs everything. All those programs. Yes.
Okay. If you're watching us, we are talking about how to take care of your spine. I'm hosting Dr. Immaculate Wambalaba. She is a chiropractor. And engage with us. Our SMS line is 22232. That is 22232. You can also get us live on Facebook and YouTube. Our handle is at Hope TV Kenya. In a short while, we'll be getting to your questions and your comments. I know you have so many questions. And you know a common one, especially from ladies, Mugongo. My back, I can't sleep, I can't do anything. What happens? We'll be getting to them. So keep them coming. We'll be getting to them in a short while. So let's start there. I have spine pain. What is happening to me?
Okay, so spine pain can come about through different causes. So one, you can have spine pain brought about by some traumatic incident. Maybe you fell. Maybe you went to sit down and you missed the chair. You see, those are all little small things, but they do affect the spine and can actually either cause also the muscles around this spine, because you know muscles are around and muscles attach from the spine to different parts, by the way. So you find when traumas happen, they can actually destabilize the spine in a way. So, and how does the body alert you? It'll give you pain. You will feel pain.
Yes.
Two, our daily habits can also bring us spine pain.
Which ones, Dr. Ari?
Sitting, we are a sitting people, which is so bad for the back. We sit at home.
Yes.
We sit in the jam. We come to sit at work at all those meetings. And then we'll sit back in the jam again. Then we'll get home. We are so tired. We sit again. So we sit a lot. So what you do with your body often. So those are the people who sit for too long. Then there are those who also stand for too long. But then how they stand, they're not standing well, which now brings me to that word I love,
Yes.
posture. Posture, 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 my dear, is very critical. Because if you keep bad posture, you will get back pain.
So what is bad posture, Dr. Immaculate? You see, I could be sitting and I think I've given it my best and I want to lean back, relax, enjoy my Kenyan cup of tea as I watch Hop TV. So what do you mean by posture? How are you supposed to sit? And for those who are standing, how are you supposed to stand to ensure that I take care of my spine?
Okay, the basic positions we take, either we are sleeping, we are sitting, or we are standing. Those are the basics.
Yes.
And then we have now those ones where we are walking and moving, which now comes to the accessories like your shoes. All those are very important. So let's start with basically how you sleep. First of all, the number one major piece of equipment you need to sleep is a mattress.
Yes.
And number two, a pillow. Those are critical pieces of equipment in your home. They are so critical because if they are bad, they will affect your back. So also that will tell us some of the things we use. If you have a bad mattress that is not supporting your spine when you sleep, you can develop back pain. A mattress that is so old, imebondeka bondeka, yani you go in and you disappear inside there.
Yeah.
That one is not supporting you anymore.
Yeah.
It will give you pain. It will give you back pain. You wake up, you feel so tired. Actually, some people who sleep, but when they wake up, they wonder, nimelala kweli? Ama, what have I been doing?
Yeah.
So your mattress, your mattress has to be of good quality. It should be firm enough, but not too hard like the floor, else we don't need mattresses. Let's just sleep on the floor.
Yeah.
And your pillow to support your neck. Not a pillow too thick, not too thin, just right to be able to support the neck. Because remember, you have this gap when you lie down. Now, the position for sleeping that is advised, it is best to sleep either on your back or on your side. Avoid sleeping on your stomach, which is the best dreams for very many people, but it's the worst for your spine.
What happens if you sleep on your stomach, Sally?
When you sleep on your stomach, you see your spine naturally has this curve. It's an S shape.
Yeah.
When you're looking at it, it's S shape. Now, when you sleep on your stomach, you can see you put pressure here, which in turn is going to tighten here. And then your neck, when you sleep on your stomach, you actually have to turn your neck to either side. Now, you try one day and just sit with your head turned to the side for 3 straight hours. Don't turn, don't move, just turn it. Are you seeing trouble? So you wake up, the neck is stiff, so you warm it up a little bit, you stretch, and it is fine. But with time, one day it's going to wake up and tell you, now, we cannot keep on doing this by ourselves. We need help. So sleeping on your stomach does exert pressure differently. Given that your spine curves that way, you exert different forces, and even it can cause muscles to tighten at different corners of that spine. So side sleeping, and for those people who have got who are well endowed, let's put it that way.
Oh, yes.
Yes. What you can do is sometimes they feel very uncomfortable having their legs straight. So when you're sleeping on your back, put a pillow under your knees. That will just help to relax the low back and give you more comfort in the back when you sleep.
And that means the mattress must be in good shape.
Mattress in good shape, put a pillow under the knees, and you're good to go.
Okay.
Yes. The next position that we do, that if we don't do, first of all, sitting for very long is not very healthy, because number one, other than just the spine, we are creatures who are made to be mobile.
Yes.
So also sitting for very long can cause muscles in the body to tense and to sit contracted for so long. So it is advised when you sit, do not sit for 2 hours straight. Break it up. Break it up every hour, get up, which means if you're sitting at your desk at work and you have a computer, a printer, and maybe you have a table with maybe some water, don't have them at arm's length. Put the water there, put your printer there so that you have to get up.
Yes.
and go to them. That short break makes such a difference for the spine. It makes such a difference. Whereas when you sit at a meeting for 3 hours, I always wish to tell CEOs and chairs of meetings, every hour tell your members to just stand for 1 minute and they sit again. Now, so break up the sitting. Now, but have a good chair. Have a good chair.
Yes.
Because if you're going to have a chair that does not support your back when you sit, then that's even double tragedy.
Yeah.
So a good chair when you go to sit, so how do you sit well? Make sure when you go to sit, some of us even waste that chair. The chair has all this space, but then you're sitting on it here.
Yeah.
So why did the carpenter put this here?
Maybe
So
you're short, daktari.
Short legs, we shall put some stool for you to put your leg.
And move on the back.
So the best thing to do is when you go to sit, take your bottom all the way to the back of the chair, and you'll now find the back of the chair will support your spine so that you also relax your shoulders and you sit. Better still, if you want to cross, see, I put my feet flat on the floor, or you can cross them. That's best. Better than you actually crossing your leg over the knee. And that's a lot of people do that,
Yes.
but it's actually not very healthy for the spine.
Okay.
Put your feet flat on the ground or cross them as you are crossing them.
On the lower end.
At the ankles, you're good to go.
Okay.
So that is sitting. Make sure the chair, and make sure the chair doesn't sag. You're not also getting lost. Remember, the spine is about support.
Yes.
Let it be supported by your pieces of furniture, okay? And then the other position we do is standing. Now, I told you earlier on, those who stand for very long hours, one, wear comfortable shoes. If I know I'll be standing for a long time, in fact, even when I'm working, I would never wear a heel because you need to be comfortable. So what type of shoe are you wearing? Because your shoe also can affect your back. I see our young sisters, and nowadays, even this, all our nice mamas who want to slay away, putting on this pointy heel and it's all this high, big. That is a massive pressure on your back. Because remember, what are you? You're putting all your weight to be carried on 2 little tips. That can't, it's not enough. So what happens? What does the body do? It translates it back so that your back will be able to pick up the slack and hold you upright. So a very high heel is not very good for standing long. Now, if you're going to just be entering a meeting and sitting and to look pretty, fantastic.
Yes.
But if you're going to be walking down Tomboya, because please get a comfortable shoe. And then for those who are going to be standing, like I can see, like our producers here, our video camera people,
Yes.
have a comfortable shoe also as well, but also how you stand, it matters. Put your weight on both your feet. Don't stand on one leg. I always say it in a nice way like this. God gave you 2 legs. Why are you standing on 1.5? God gave you 2 bottoms. Why are you sitting on 1.5 or 1 only? Stand on both. Yes. Put your weight. And men, it's easier for men because they can slightly spread. So when you stand, you're standing for long, slightly spread your feet and then let your feet and gravity hold you down. You'll find, by the way, you'll stand longer.
Yes.
Than when you try and stand and lean onto one hip, which most of us do all the time. Now, when you do that, you're actually starting to affect the alignment in the pelvis because of the shifting all the time. So you constantly have that habit where when you stand, you're leaning on one leg.
Yes.
As you train that tomato plant, it will grow the way you want. So you train it to be this way, it will keep going that way. But remember, as it's going, it's starting to affect all this other way. So when you stand on both your feet and rest comfortably and have comfortable shoes.
Okay.
Yeah.
You know, you're talking about, standing posture. I thought of those people who do the dancing and... oh, story for another day.
Movement is good. Movement is good.
Okay, that's movement important.
Yes.
But just ensure you don't put all your weight in one point.
Yeah, actually, yes. Use your body. Your body, by the way, will tell you how to use it. Yes.
Okay.
Naturally, your body just knows its rightful way to be used. And with time, if you abuse it, it will start to cry out.
Pain. Do you have some spine disorders, Daktari?
Oh yeah, plenty.
Let's talk about that.
Okay. Spine disorders can actually fall in two categories. I'll start with the ones that are the normal day-to-day. You have got wear and tear. All of us are using this spine every day. For anything you do, you are using your body. So there is definitely a degree of wear and tear. Think about tires on a car. Even if it's a new tire, as long as you keep driving, that tire will wear out and it will need to be changed. Unfortunately, ours we cannot keep changing. So as we age, you find there's wear and tear. And that's why you find as people age, they start getting things like arthritis. Okay?
Yes.
So arthritis is one of the many things that we see coming into the office a lot. And up to now, we can actually say there's not a cure per se for arthritis, but it is managed. And that's part of some of the things we do take care of, people who have arthritis. And a lot of that, our mamas, our shoshos, a lot of them, it's because of arthritis, swelling, the joints swell, they get inflamed. And when it's cold, it's just bad. They can't walk because it's stiffness and rigidity in there. We also have sometimes those who have disc diseases. We have diseases that can affect the disc, and the disc can be affected by these diseases, but also when you have trauma, when you're in an accident, when you fall, those things can affect the disc, can affect the joint. You can get fractures. These bones can break, just like any other bone, they can actually break. Okay?
Yes.
So you find you can get fractures, you have arthritis, all those degenerative conditions that can come therein. Now, plus maybe now the others that happen without our knowledge knowing, we have cancer that can affect the spine as well. And even some other cancers that you have in the body, stomach cancer, prostate cancer, with time as they spread into the body, they can affect the spine. Because some of them eat up on the bone, some of them do other things that affect the structure of the bone. So many things can actually affect the spine in that regard. And many other conditions that come. You can also just be born with an abnormal spine. We have people who are born with abnormal spine. Some vertebrae are missing. Some didn't separate. Like you see, for some, this bottom one fuses to this other one. So those are some of the things. Some people have extra ribs. So there's some things which you are born with.
Yeah.
That now can be problems. Some you can find there's a joint. Now this now moves beyond the spine. Some joints and bones don't mature. They remain small and stunted. You know, like you can find even those who have vitamin deficiencies that affect bones, scurvy and all those things that can cause rickets. All those are things that affect bone. So even the spine has some things that can affect it as well. Yes.
And how can one know that for sure I'm having a spine disorder and I need help?
When you start getting discomfort, you start having pain, and you notice it's pain that's starting to show up. It comes today, then maybe after 2 days, just go in and be checked. You know, one of the things, the habits we have in Kenya and as Africans, which is very unfortunate, we wait until it is bad.
Si uchungu sana.
Si uchungu sana, ni kidogo kidogo tunaendelea tu vibaya.
Yes.
You know,
yes.
It's like when you enter your car, you turn it on and that light flashes and disappears. The next time it will flash, stay on a little bit and disappear. One day, ultimately, that light is going to stay on.
Yes.
And the next time you will try to start that car, it will have knocked. So let's get it when it flashes one. You're like, okay, what was that? Should it happen again, go in for a consultation. Go to the doctor and say, I'm feeling this, what could it be? Now, if if you go to the doctor, one thing they can say, if they listen to what you say, what you're complaining about, they can send you for an x-ray. Now, x-rays will show you clearly what's happening on bone. We have CT scans. We have a lot of imaging that can be done. As depending on the symptoms someone presents with, you can tell maybe if you need imaging. You can tell if maybe this is just a joint issue. And then also, for us as chiropractors, we don't only work on people who are sick.
Yes.
Chiropractic should actually be a lifestyle. The same way, even if you have no complaint, make it a point at least twice a year see your chiropractor, because you're using this body.
Yes.
Things can get jolted. And by the way, some of these misalignments, when they happen, you won't tell. And sometimes it just takes a small movement. It's not grossly a big thing like when you got hit by a truck, ukapasuka hivi na hivi. Apana, sometimes it's just that constant bad chair you're sitting on, it moves it. So when you come to see us, we are able to tell this is out of alignment even before it starts talking to you.
Yes.
So it should be just habit that the way you take your car for service, take yourself for service, take yourself to be checked. We take care of those things.
Yes.
Now that people are getting aware, chiropractors not only take care of people who are in active sickness or pain per se, but also just for wellness. We have patients who just come, I just want to make sure I'm well aligned. That's it, and that's good enough. Yes.
Okay. Wow. Thank you. She's called Dr. Immaculate Wambalaba. She is a chiropractor helping us answer all your questions regarding your spine health. I want us to go for a quick break. When we come back, we'll be looking at your SMSs on 22232. That is 22232. We'll also check your feedback at Hope TV Kenya. Why am I saying FM? That's our sister station. At Hope TV Kenya on Facebook and YouTube. What you're saying. And of course, when you come back, Daktari, you know,
Yes.
expectant mothers, they cry a lot about this area. So what usually happens and how can they take care of the spine
I
as
love
they
them.
bring life? Let's have a quick break. We'll be right back.
Every Wednesday at 7:30 p.m. Spotlight.
Do you feel that they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking,
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi. Hope TV is now available on GoTV Channel 103, Zuku Channel 873, Signet Channel 817, and Star Times Channel 026. Enjoy our uplifting content and family-friendly programming anytime. Hope TV, you look and live.
Welcome back to Health Check on Hope TV, Look and Live. My name is Grace Mutiso and I'm excited about today's topic because you're focusing on the most important part of your body and my body, that is the spine. And how do we take care of it? How are we able to tell that I have a healthy spine, you know? And we stopped at a point where Dr. Immaculate was telling us, you need to make that appointment at least twice a year to see a chiropractor to ensure that you're doing well. And thank you everybody watching us on Facebook at Hope TV Kenya and on YouTube at Hope TV Kenya. And for those SMSing in a short while, we'll be getting to answer some of your questions that you have forwarded to us in a short while. Daktari, welcome back.
Asante.
So let's talk about this special category of people, the expectant mothers, you know, bringing forth life for 9 months.
Wow.
And I'm sure one of the most common questions is my back.
Yes.
And that's where the spine is. Or my, how do you call this area? Pelvic
pelvis,
area?
yes.
What usually happens and what can you tell expectant mothers?
I think that's as a group of people, women I love. I love expectant mothers. I love women who are in childbirth. I just love women. But that category of people is because they're actually participating in such a special moment. In creation, you're co-creating with God. You have given yourself to carry. Now, what happens in pregnancy is that your body will go through myriads of changes, seasons of changes. Between the first trimester, the second trimester, the third trimester, your body is changing as this life is being formed within you. That means when we start as microscopic cells, remember these microscopic cells within that 9 months have to come out as a baby, at least 3 kilos.
Yes.
So you just imagine that uterus that is small like that has to expand to carry this watermelon. What impact does that have on the back? Number one, a lot of gravitational changes. When you're not pregnant, you're able to stand upright and there is nothing pulling you forward or backward. But when you're pregnant, you have this belly that's now growing. And for you to accommodate it, you can't keep on standing like that. So with time, you notice between the beginning and towards the end, most pregnant mothers' posture and stance is this.
Yes.
It's adding extra support to help the back to carry you with the extra you are carrying.
Yes.
So gravitational changes will happen, and that means your spine also has to morph with those changes happening with you to accommodate the way your body is changing. So that's what affects the back a lot. Ligaments, as you move into the pregnancy, ligaments also start to change, because remember now towards delivery, your pelvis has to be soft enough to be able to expand for the delivery of this baby to happen. At that time and that season, a lot of hormones are released in the body and things to help those ligaments loosen up. Otherwise, if you remain rigid, I don't think we shall push these babies out. So the body goes into a relaxed mode. Now, when the body goes into a relaxed mode in that pelvic area, it's very easy because now the joint is not tight.
Yes.
It's very easy for those bones to move out of place. So you find this joint's right in here, this one's in here. This is your pelvis. Even inside this area, the pubic area, all this starts to loosen up to allow for expansion for delivery. So in the process of loosening up and the discomfort of, I cannot sleep well, things can move out of place.
Yes.
Now, what do you do? And you're there, it is happening. There are people who have a very smooth pregnancy, but many people don't. Now, chiropractic is very helpful during pregnancy because we help you to keep your alignment through. So as your body is changing, we are helping you to change with it. If we are making sure that nothing is going squiff so badly that by the time it comes time for delivery, it is just another story altogether. One of the benefits of chiropractic actually is, you see, when you have good pelvic alignment, you find even your ability to open up is much more than when your pelvis is misaligned. You actually don't open up very much.
Yeah.
Two, also, if you have good alignment, your muscle tone is actually much better and more, you'll be more comfortable even through that process. So the pregnant women should not fear coming to see chiropractors. We know how to take care of you. We know how to position you so that we can work on you. And in fact, for very many of them, that's a time they get very excited because they can actually lay on their belly to just ease the pressure on the back. So chiropractic and pregnancy work very well together. So those pains, we make sure you're well aligned so that the pains and the discomforts are not there. As the body is changing, so we help you to change, but change in alignment with the changes that come. Yes.
So assume this pregnant mother has come, you've sorted them out. So what's the best sleeping position? Because it's a struggle. You sleep on the back? Sleep on the side? So what's the best position so that they also take care of their spine?
During pregnancy, those pillows, you have to just find pillows, tuck them where you need to tuck. Just do what you have to do. There are actually now body pillows that pregnant women can use. That pillow between the legs really will help for pregnant women. That pillow between the legs helps, and pretty much you're sleeping on your side all the time. because after a certain stage, you don't sleep on your back. So if your mattress, also a good mattress comes in there to support you.
Yes.
You know, so you just keep turning, use your pillows, and then also walk, be active. Don't just be pregnant and sit. A little, I've not said go and run and now do a marathon, no. Just walk. That helps also to keep those joints moving and the muscles stretching. And that also makes it a bit more comfortable. Even during pregnancy, keep proper posture. It helps. It helps, yeah.
In standing,
sitting. Yeah. In fact, as the more pregnant you become, you actually find naturally you will sit with your feet a little bit apart. Don't try and squeeze yourself. Be comfortable.
Yeah.
Just put on this, cover yourself up, and just sit. Because you are accommodating. So if you're trying to hold you'll get tired. In fact, that's where you strain your back. Trying to be proper. But there's a trend though, even on clothing, I'm noticing that now pregnant women are tending to be in very tight clothes. You're going through change. Be comfortable. I don't think the old maternity clothes they did not have a reason why they needed them to be big and spacious. It's for your comfort. So these clothes which are very tight also can be very restrictive, but many will tell you they're comfortable. But I'd always advise, be comfortable even in what you're wearing and in how you're carrying yourself around. Put on easy shoes. Sneakers are good during pregnancy. I see them in heels nowadays. I don't think that is wisdom. Just put on a comfortable shoe. Yes.
Okay, thank you. We have received some few questions coming through. Our SMS line is 22232. That is 22232. Or you can get us on Facebook and YouTube. The handle is at Hope TV Kenya. The first one writes in and says, I'm going through physiotherapy due to strain around the lumbar area. How long should it take to feel normal? I'm 60 years old. He's a gentleman.
Okay, that one is a bit a broad question because one, I do not know what the physiotherapist is working on. Two, I do not know how long he has been in this condition that he has had, because if it is something that we call chronic, you have had it for very long. That all will take time to go. But if you're finding that maybe it's still taking long, also have a chiropractor look to make sure that even as the physio is doing what they're doing, let's make sure that also the alignment is good at the same time, because physiotherapists actually, they will work on making sure the ligaments are good. You should actually get a physio to come and tell you what they do. But I
actually wanted to ask, what's the difference between a physiotherapist and a chiropractor?
For us, I'll just say rehabilitation and correction. Chiropractors specialize in correction of misalignments.
Okay. Around the spine.
Around the spine.
Okay.
And others also work extra spinal. Some work on joints, other joints of the body.
Yes.
But our key area of focus is the spine. Now, if you're doing physio and you are not responding, maybe have a second look to see, could it be that we are busy physioing somewhere where there is a misalignment? Because correcting that misalignment makes all the difference.
Yes.
For that physio to help to take effect. Yes.
Okay.
So it now just depends. It's quite ambiguous. I don't know what it is he's doing physio for and how long he has been in that state. Otherwise, better still, maybe a consult can help so that we can understand what is happening.
Okay.
Yes.
A second one is asking, what's normally the problem when you feel your upper side of your waist gets hot at times while you are seated?
If your upper part of the body is getting hot while you're seated, number one...
The upper side of your waist feels hot when you're seated sometimes.
If you're not sitting in a hot room, your body should be able to regulate its temperature. So if you're feeling heat, is it heat coming with discomfort? Is it heat coming... that's also a very it's quite broad as well. But if you're having different heat sensations, that's a nerve issue. So we should also look to see what's happening there, because you should be able to control, your body should have that ability to control its temperature. So if you're feeling hot at a specific place and maybe it's also coming with discomfort, please let's have a look at that. Go in and have that looked at. Yes.
So the first person they should approach is a chiropractor?
They can come. And now if it is something beyond us, we have other practitioners who take care. We have orthopedics, we have neurosurgeons. We all work together for the betterment of the patient. So if it's something that is beyond, when we realize it's something beyond our jurisdiction, then we forward you to the necessary person. But come in, we can have a look and advise from that point on. Yes.
We'll keep sampling some of your questions on 22232 and at Hope TV Kenya on Facebook and YouTube. Keep them coming, keep them coming. And a good friend of mine called Linda just said, you know, her life changed when she visited a chiropractor. She had zungukad with a backache.
Very good.
Immediately she visited a chiropractor, her life changed. So
Yes.
she's a living testimony.
Oh,
that it
yes.
worked.
Oh, we thank God for that.
So Dr. Ree talked about sitting position, sitting posture, standing posture, sleeping posture, the shoes you need to wear. What about lifting things?
Oh, yeah. You must lift properly. Many times, if you don't lift well, chances of pulling a muscle, throwing the things out of place are very high. Most of us actually pick up things, particularly heavy things, in a wrong way. I think the best is, let me tell you the right way on how you should pick up something. Like, let's say you have a box you want to go down to pick. Number one, don't lock your knees. Keep them soft and bend them.
What do you mean by locking, Daktari?
Now that means I stand to demonstrate.
Director, please allow Daktari to demonstrate, please.
You see, when we say keep the knees soft, when you go to pick, go bend with your knees also bend. Okay. Don't just go for it like this. That's what I mean when you lock the knees back this way. Because that way you exert a lot of pressure in the back. But when you bend your knees, you have already relaxed the back. Number two, you'll definitely keep your feet apart.
Yes.
So you go down, and then don't use your back to lift and come up. Use your leg muscles to bring you up. Because if you use your back, it could be too heavy, that can be too strong and overpower your back's ability to do that. And if particularly you're not a person who exercises, you know?
Yes.
So if you're going to pick a box, bend your knees, come up, and let your legs bring you up. That is the bad one.
I've seen the difference.
You've seen the difference.
Do it again, Daktari.
So don't do this.
Just pick and up.
Don't pick and up.
Okay.
And use your legs to bring you up. Yes.
Use your legs to bring you up.
Yeah, use these thigh muscles. They work well together with your back. It makes it easy. But also, sometimes if the load is too heavy, why don't you get help? Or split it into two. You have such a big piece of shopping bag, get 2 bags. Call somebody else. If it's a sack of potatoes, get someone to help you. That also helps, because if here you are, you're trying to carry that 90 kg sack on your own. You know, which brings me to something else.
Yes.
You see, these people who carry sacks, the farmers, with time, you know, you get so used to doing these things. And actually, those are some of the activities. Those are people who do high level of activity.
Yes.
Their muscles are working. Sometimes those loads can actually affect, with time, the alignment and the integrity of the spine. Particularly if you're lifting a load too heavy. So you mightn't feel it when you're doing it. And like most of our grandmothers, now I'll talk about our senior citizens.
Yes.
Our grandmothers in their day, they did a lot of farm work. They came home and they did work. They bore so many children in a certain span of time. And you know, given the African culture, this is a strong woman. This is Sampulia Bibi, wife material. But right now, later on is when now we start seeing them coming. And they'll tell you, oh, there's a day I fell in the farm, but I just woke up and I continued. And I did this and that. So some of these things they do, if you're doing heavy work all the time, all the more reason always make sure you're maintaining your spine. If you're doing heavy work that labor intensive,
Yes.
carrying, lifting, if you can, please come and let us keep your spine in line, because moving those bones out of place is very easy over time. And later on, it can come to haunt you later when you're older.
Yes.
When now it starts to be real, you have really used that, and it is wear and tear proper. So while you're doing that work, make sure you take care of your back at the same time.
Okay.
Yes.
You mentioned the gym, and these days everybody wants to live healthy, and maintain those figure, and muscles. How does that affect the spine if it does in any way, if done the wrong way?
The gym, that is one place sometimes I've gotten into bad books with my patients, because I tell them no going to the gym for a while. And they're like, why? Why not? Number one, gym. If you know what you are doing and you do it well, such that whatever exercise you are doing, follow proper positioning, do the exercise well. If you want to do the lifting, the weights, make sure you are holding them well. Make sure you are lifting it well, because a lot of people pick up back injuries from the gym. So if you're exercising, do it right. If you're playing golf, make sure your stance is good and your technique is good. If you don't have good technique for whatever sport it is you're doing in the gym or wherever, leave that sport alone, because you're preparing yourself for trouble. So what does that go beyond? Have a trainer look at you. Is my form right? Have I stood right to do this exercise? So do the exercise properly. Number two, overworking. You cannot be in the gym daily doing
really?
heavy work like that. When do you rest? When do your muscles get to rest and recuperate and heal? You must give the body time to rest. So working out every day, 3 hours a day, that is overuse. And it's not beneficial, because you will tire out, and actually you wear out your body even more. So a little bit, you control it, it's kidogo kidogo. Si kila, na siku zingine pumzika.
Okay.
Yeah, rest. And then also, I think those are the things in the gym, how you're working out, and then have proper gym shoes. Don't go on the treadmill with ngomas.
Yeah.
Put on your nice walking shoes and go walking. The same about going to walk on the road.
Yes.
And you have got, what are these? Crocs.
Have proper shoes.
Use proper workout attire when you're working out. Yes, but it is healthy to work out. Yes, it is healthy.
And Dr. you're mentioning proper shoes. Proper shoes to Grace could be different to Eunice, could be without mentioning brands. So what should this shoe look like?
One, let's start from the gym. That's where we've just come from. A proper sports shoe has been built to withstand the impact, or even for running. Athletes' shoes have been actually engineered. They're just not just thrown together and made a shoe. They engineer because they look at sports science, the impact that someone is going through when they're running. So your shoe is made with the shock absorbing capacity and ability that makes that impact, the shoe absorb the impact rather than your back and your joints. So when you actually don't use a proper shoe for either running, walking, or in the gym, or you're doing aerobics in a wrong shoe, you're going to work out, yes, but the impact will affect your joints and even more so your back. We talked about good shoes. Baby dolls are very good shoes. These very flat shoes, they're comfortable. But you also want a shoe that will give you support even on the arches. And these very flat baby doll shoes we wear, they don't give support. So if you're going to stand for long, make sure the shoe you have has got that insole that actually cradles and cushions the arch of your foot. If you find some people have actually flat arches, the arch of the foot, let me also maybe say, so maybe someone wondering what is an arch.
Yes.
Your foot is here, there's a part that raises up, ukuchini, that arch right there. Some people's arches are flat. Get something that supports. Some have got very high arches. Support those arches so that they don't collapse. And that means a good shoe. You invest in a good shoe. Second-hand shoes are not bad. But remember, somebody else with a different type of foot has worn that shoe. So if it has been overused by the previous user, let's put all the juices of that shoe and the impact has gone.
Okay.
So as much as you can, if you're getting second-hand, do get those ones that are still a bit on the newer side that haven't been used so much. High heels, and a good heel can be 3 inches, but let it be a broad heel, not pointed. A box heel.
Yes.
Wedges are good. Okay? But avoid the tippy toes and then the ones which are so pointed like this, because they'll just squish your toes. So just let it also be comfortable and then put on a shoe that fits your foot. Usiseme I will squeeze it until buy a shoe at the end of the day.
Okay.
When your foot has expanded enough.
A proper one. Daktari. My director tells me we have 2 minutes. Allow us to quickly answer these questions.
Yes.
What is the best way to carry a laptop on your back? Is there a best way?
Backpack on your back.
Okay. Backpack on your back. Angela, that's Joseph Karogo on Facebook. Angela Ndereyeyo says, thanks for the talk. One thing I noticed is the height of the chair, e.g. sofa, dining chair, etc. does matter. And even the height of the bed should correspond to one's height. Should the height of the chair, the bed, correspond to one's height?
Actually, when you sit, you should be comfortable between the knee, how the knee folds and the foot. So that's when we talked of short people. Just get a step stool and step on it.
Okay.
So that you're not hanging your feet there. You don't want blood to pool there. So a chair that's of good height is good enough and good support.
Okay.
Okay?
Okay. And Shelmate Joseph, thank you for tuning in. You're saying very educative and you're learning a lot. And thank you so much for keeping it right here. Oh, one more, Director. What causes back pain after going through CS? How should I handle that pain?
Take care of yourself as you're taking care of the baby. Walk a lot. Use higher surfaces so that you're not bending too much also. And then give your body time to also recover. But if it is persistent, please let us have a look at that.
Okay. Oh, Daktari, we have to call it a day. Are there special foods that people can eat to help take care of the spine?
Just have a balanced diet.
A balanced
Just
diet.
eat a balanced diet, yes. It's important. But of course, you need calcium. Bones, we are talking calcium. Have good calcium in your body. Nerves, we are talking get foods rich in B vitamins. Very important, B12 for the nerves. So those. But if you have a balanced diet, our foods have all those things. Balance it.
Okay.
Yeah.
And if somebody comes to a chiropractor, what's the first thing they do? In a minute, Daktari.
In a minute. Let them come in and we shall greet, then we'll talk. Tell me why you have come. I'll ask you questions. Tell me what you're feeling. We will examine you. We will do some tests. If we need imaging, we shall take imaging. And then after that, we shall adjust your spine.
Okay.
Yes.
Thank you, Daktari. Your parting shot.
Your spine is important. Take care of it. And remember, it is what houses the most critical part that causes you to function. Take care of it. It is very important. And we are here. We are specifically trained to take care of your spine. So come, do not have fear. Do not be afraid. People get afraid of coming to chiropractors, maybe because of what they've seen or heard. But we are careful. We are trained. We just don't come out from the road.
I hear you. Thank you. Thank you, Dr. Immaculate Wambalaba, for gracing us today. We
Thank you,
appreciate
Grace.
you. I've learned a lot. I'm sure our viewers have learned a lot too. May the Lord bless you as you keep doing the
You too,
excellent
dear.
job. Amen.
Thank you.
And that's all the time we had for you on Health Check tonight. We apologize if you could not be able to get to your question. But you know what? I'm sure my producer will invite Dr. Immaculate once again and we'll be able to get to your questions. And of course, she will be able to give you contacts if you need to get in touch with Dr. Immaculate. It's been a great joy serving you. My name is Grace Mutiso. Have a beautiful, beautiful evening. Keep it Hope TV, look and live. Stand by, great programming lined up for you. I'll see you next week, God willing, same station, same time. Of course, different guests, different clothes, different sets. Bye-bye for now.